Good evening, everyone. Thank you for joining us for the world premiere of Sandro Lift, a bold clinical innovation to treat under-eye circles and an advancement in skin remodeling. Tonight's presentation features a cutting-edge new treatment created by Dr. Mike Ellis, utilizing the Sandro Dual laser system developed by Wontech. Wontech is a rapidly growing company in the world of laser and light-based aesthetic devices. For the last 22 years, Wontech has placed research and development at the forefront of their approach to the global market. This has led to the development of over 50 types of laser devices, ranging from home care, tattoo removal, skin rejuvenation, vascular, surgical, and even veterinary devices. Wontech currently offers one of the largest product portfolios in the industry, exporting to over 60 countries worldwide. The Sandro Dual is a long-pulsed 755 nanometer alexandrite and 1064 nanometer ND-YAG system indicated for hair removal, pigmentation, vascular lesions, and skin rejuvenation. The Sandro Dual offers a wide range of pulse durations, higher repetition rates, and various spot sizes ranging from 2 to 20 millimeters. What sets Sandro Dual apart from its competition is the hybrid mode capability, a feature that emits 2 wavelengths at a preset time interval, either sequentially or in reverse order. This allows for better safety and efficacy when performing hair removal and vascular treatments on all skin types. The system also features a real-time temperature sensing indicator on the handpiece itself, providing an additional safety advantage and better control over the treatment. Sandro Dual offers 2 optional cooling methods, customizable cryogen gas cooling or an optional air cooling connector. Tonight's presenter is Dr. Mike Ellis, owner and medical director of Keep Glowing Medical Spa in Tinton Falls, New Jersey. Dr. Mike began his career as a hospitalist, subsequently shifting to a focus in aesthetics, and now serves as a lead investigator for Wontech and MD360. By exploring the capabilities of devices like Sandro Dual, Dr. Mike has been a major contributor in developing advanced protocols to enhance treatment outcomes and further indications. Questions are welcome throughout the duration of the presentation. We ask that you type them in the control panel of the GoToWebinar question box. If there are any questions we're unable to answer within the allotted time, we will follow up with you directly via email afterwards. We'll also hear briefly from MD360's Director of MD Power, Chris Stock, regarding the MD360 Power Program, a program designed with your practice in mind to boost conversion rates and streamline sales processes, exclusively available to MD360 customers. With that being said, I'd like to welcome Dr. Mike. Mike, we're turning it over to you.
All right, thank you, Caitlin. Like you said, I'm Dr. Mike. I have been working with Wontech to deliver and create this excellent procedure. So I'd like to give you guys a little background on the procedure, a little bit of the science, show you some of the results we have, and then we'll get into a live demo a little bit later as well. So as Caitlin described earlier, the procedure is done with the Sandro Dual device. Sandro Lift procedure is a protocol we developed using the Sandro Dual hybrid laser platform. I just said Wontech is based out of Seoul, South Korea, and is one of the top laser manufacturers in all of Asia. The device is 2 lasers in one. It contains the 755 alexandrite laser and the ND-YAG 1064 laser. What's unique about this product is that these lasers can be fired independently of each other, but they can also be fired at the same time. The operator can switch between the 2 wavelengths during treatment quickly by tapping the screen, or they can use the preset settings within the device as well. Hybrid mode is unique because it allows the operator to choose which wavelength to fire first, and it will fire the wavelengths basically simultaneously, allowing you to kind of take advantage of the thermal relaxation time and use 2 treatments in one. Another great thing about this device is that everything is customizable. Every single setting you could change. Your tip is customizable, so it's an excellent machine if you're looking to do a lot of different things. So by offering 2 different wavelengths, you have the capability of 2 machines in one device. With your 755 alexandrite laser, you're looking at your gold standard for hair removal in your lighter skin types, your Fitzpatrick's 1 through 3. You can treat pigment and melanin, including birthmarks, freckles, sunspots, age spots. You even treat some of the vessels. Coming into play is the 1064, your ND-YAG. This is going to be your hair removal for your darker skin types. This is actually what we're going to use for our skin rejuvenation and tightening by way of effects on collagen. Another utilization is for vessels. It also does a great job for active inflammatory lesions, acne, or acne scars. So just want to touch real quick on the unique aspect of this with the hybrid mode. So once again, I said hybrid mode, you have the choice to discharge either your 755 first or your 1064 first. The most effective use I found this for is using hybrid mode for resistant vessels or rosacea. You can use it for pigment and lesions, but I really love it for vessels. I've got the question, why does it work for vessels? So with vessels, you are treating and trying to occlude and obliterate the vessels. So in hybrid mode, if you're delivering your 755 first, hello? Sorry, anyway, your 755 changes your hemoglobin into a methemoglobin molecule. Then by firing your 1064, milliseconds behind that, you're able to target that water molecule on the methemoglobin, causing better obliteration of the vessel. So these wavelengths can really be, like I said, discharged milliseconds apart. Your thermal relaxation time when you're treating a vessel is between 4 to 50 milliseconds, depending on the size of the vessel. So like I said, you're going to get better treatment, less treatment numbers, less pain, and better results for your patients. So I'd like to introduce to everybody orbital aesthetics. Orbital aesthetics is the concentration of treatments around the periorbital region in the aesthetic field. The periorbital region has become an area of focus, mainly due to the COVID-19 pandemic. They're calling this nowadays the Zoom boom. I guarantee you most of the people on this call have looked at themselves at least once in the past 5 minutes. They actually have done studies on this showing that 70% of the time spent on Zoom calls, people are spending the time looking at themselves instead of looking at the presenter. So another thing is also people are now focusing more on what they perceive as blemishes on their faces because they're spending more time looking at themselves versus before COVID, before Zoom, you might have just glanced at yourself a couple of times in the mirror. Now you're spending hours on these Zoom calls a day looking at yourself for hours at a time. Mask utilization is another reason why this trend is coming to be. You're covering the mask, you're covering the nose, the mouth, the lower face. So the only visible area while wearing a mask is really your eyes and your forehead. So we refer to the aesthetic treatments in the periorbital area as orbital aesthetics. If you look up some of the Google trends, you'll see an uptick in Google searches for patients interested in periorbital treatments, including reduction of crow's feet, elimination of under eye bags, under eye circles, and treatment for sagging eyelids. People are also becoming more familiar and more interested in the non-surgical procedures and the minimal downtime procedures. So we're going to go into a little bit of facial aging and why our face ages and then why we could treat it. So collagen is always our hot topic, our buzzword around skin aging and rejuvenation. We have collagen products that are consumable. Most of the non-surgical rejuvenated treatments focus on collagen treatments. So in younger skin, you have tighter layers and well-organized sheets of collagen. As we begin to age, these well-organized formed collagen sheets become disorganized. Our skin becomes less elastic due to loss of elastin. And overall, the skin just becomes weaker, leading to these signs of aging and wrinkled skin. Most of these structural properties lead to, like I said, the loss of the dermal system in the face, which contributes to the other signs of aging, all which we're going to get into a bit later. So the secret to a youthful face lies within what is called the triangle of youth. A triangle of youth consists of, excuse me. Triangle of youth consists of your high cheekbones, your full cheeks, and your well-defined jawline. There are changes within these distinct regions that change over the decade that cause facial aging. So starting in our 20s, we do start to see some superficial changes in our skin. We start to accumulate superficial sun damage, with toxin exposure, sun exposure, and overall health plays a role in our skin health as well. We begin to see thickening of the epidermis, thinning of the dermis, a decrease in the quality of the natural production of hyaluronic acid, collagen, and elastin. You also have dilation of the capillaries, which becomes most notable around the nose and in the under eye region. Through our 20s, we start to develop fine lines. We lose the youthful plumpness of our skin, and our skin tone begins to change as well. In our 30s, we begin to see signs of change in the facial structural support system, mainly in the fat pads. We do have continued change of the superficial layers of the skin, but our deep fat pads begin to decrease in volume, which is why we start to see the decrease and shift in facial volume as we age. Another thing with these fat pads is as these deep fat pads begin to change in volume and strength, they lose the ability to fully support the superficial fat pads, which leads to the outward appearance of sagging skin and development of the deep lines and wrinkles in our faces. So we come into our 40s, the structural support system in the face undergoes the major changes. You have continued weakening of these deep fat pads, which results in even less support of these superficial fat pads. The superficial fat pads begin to further sag, their volume begins to change once again, and you have these shifts which lead to our deep wrinkles. We also begin to have some of the deep retaining ligaments and fascia that support the deep fat pads begin to break down, they begin to become a little bit weak. You can actually start to see some of the protrusion of the fat pads through these ligaments, and superficially you can start to see some protrusion under the eyes or even into the cheeks. In our 50s, as our body ages, we start to lose bone density. It's no different in our face. In the faces, it leads to a widening of the orbits, flattening of the zygomatic bone. This really just results in decreased support of the overlying tissues, hollowing of the eyes, and flattening of the cheeks that we start to see in our 50s and beyond. All these aging processes basically lead us to what we call the square of an aged face. This consists of our cheek flattening, we have loss of volume and structural support of the deep fat pads, like we said, as well as augmentation in the volume of the superficial fat pads and the positioning. Loss of bone density leads to flattening of these cheeks. Our jowls begin to appear. Once again, because of that loss of structural support in the deep fat pads, these superficial fat pads are able to sag a little bit, and you start to develop jowls. And then in this case, we start to have the loose skin, sagging skin. We develop the deep wrinkles in our nasolabial folds. Crow's feet become more prevalent. Glabellar lines begin to become deeper, and other wrinkles become more apparent. So, a little bit I touched on before is we have two sets of fat pads on our faces. They are structurally independent of each other, but they do interact with each other. So if you're looking at the face, it's a house, your skull will be your foundation, your deep fat pads are going to be your beams of the house, and then your superficial fat pads are going to be your sheetrock and your outward appearance of the walls. Your deep fat pads, they're going to provide your structural support to the superficial fat pads and to the skin. Aging decreases the structural support, leading to the age-related facial changes. This also results in the change of volume in the face. Cadaver studies show that the greatest decrease in volume starts in the 6th decade of life and beyond. One thing to note is that these fat pads do not change with fluctuations in weight or fat. Superficial fat pads, these are the ones that provide basically the shape of our face and the structure of the skin. These can decrease or increase in size and in volume with weight loss or fat loss. Cadaver studies once again show that an increase in volume in these fat pads with aging, but these do have an inferior shift in the volume. Once again, these changes contribute to the age-related facial changes that we see. So getting a little bit more into the fat pads themselves. I'm going to focus really on the important ones for this discussion because we could get into a ton of it, but deep fat pads are the main support for the superficial structures of the face. These fat pads are responsible for structure as well as volume and the overall support of our faces. First fat pad we're going to touch on is your medial lateral subocularis oculi fat pads. If you look at the image, these are the fat pads right below the eye and just lateral the eye. These lay directly on the periosteum. They are low volume fat pads, but they are strongly attached to the underlying periosteum. Aging in these fat pads causes deflation, but there's actually a low tendency for sagging or ectosis of these fat pads. Our medial subocularis oculari fat pad is the one directly under our eye. Deflation causes hollowing of the infraorbital region and a V-shaped deformity, which I'll discuss a little bit later, of the lower eyelid and tear troughs. This supports the fat pad of the lower eyelid. This deflation of this can lead to protrusion of the fat of the lower eye. The lateral subocularis oculari fat pad, volume reduction in this fat pad leads to decreased support of the superficial fat pads of the malar region, leading to ptosis of the fat pads within the cheek. Our deep medial fat pad is located right in the middle of the face. Basically, they show a gradual but global decrease in volume with caudal migration. So that explains why we have that shift of volume downwards as we age and the loss of structural support. Shows that the volume loss is greatest in the upper 2/3, but some is maintained in those lower 2/3. Final deep fat pad we're going to talk about is our buccal fat pad. decrease in volume leads to a lack of support of the medial cheek and the middle cheek fat pads. This is aggravating the descent of these compartments. So this is such a large fat pad, it adds a lot of support. So decrease in this fat pad causes a bunch of the other fat pads to descend. Interior inferior protrusion of the pupil fat pad increases the convexity of the cheek and causes ptosis of the jowl. We'll get a little bit into that when we start to discuss the superficial fat pads. But superficial pads are more dynamic than the deep ones. They can fluctuate in size with weight change, like we said. These fat pads are more prone to migrate and shift their volume because of the dramatic change and cause dramatic changes in the outward appearance. First two fat pads we're going to talk about is our medial cheek fat pad and our nasolabial fat pad. So with these fat pads, the volume increases in the lower 2/3 of the medial cheek fat pad with a stable volume in the upper 1/3. The inferior volume shift within these nasolabial fat pads causes caudal migration. You have overall decreased support of from the deep malar fat pads, and volume augmentation leads to development and attributes to the death of the nasolabial folds that we all see. Our middle cheek fat pad, aging of this fat pad leads to increased convexity in the central portion of the cheek due to volume augmentation and caudal migration. So once again, this is related to the malar fat pad as we discussed before. This loss of this fat pad leads to some of the decreased volume we see in the cheek region. Then our lateral temporal cheek fat pad, this adheres to the parotid fascia without any underlying deep fat pad. You do have hypotrophic changes with aging without any caudal migration. So this is some of your temporal wasting and some of your changes you have along your jawline with your aging face. Just for completeness sake, just to mention all the other ones, we do have our superior and inferior jowl fat pads, whose volume and position changes are similar to that of the medial cheek and the nasolabial fat pads, but changes and sagging in these fat pads lead to development of jowls. So overall, our summary with facial aging, we have changes in the superficial layers of the skin first. We have a decrease in the presence and support of collagen and elastin in the skin. We have changes in the muscular support. Changes in the muscular support are actually negligent. They've shown in studies in overall facial aging. Decrease in the elastic component of the superficial muscular aponeurotic system leads to reduction of retaining capacities of the ligaments. You have changes in volume and positioning of deep and superficial fat pads. Overall, you have the outward appearance of an aging face, age-related facial changes, and the outward changes that we all see and we all get complaints about. So there are plenty of treatment options, and this list grows each day for aging skin and the aging changes of the face. Of course, the first thing we all think of is preventative measures, including overall skincare and protection, whether we're using preventative Botox, if there's going to be some type of effect with that, sunscreen, proper skincare, all important things we discuss. Everywhere in aesthetics, you do see your dermal fillers, your hyaluronic acid, your calcium base, your PLLA. All these are used to kind of rejuvenate and give some of that volume back. You also can do your fat transfers. PDO threads are now becoming very popular as well to do a non-surgical facelift and restore some of that strength and that lifted appearance of the youthful face. Always have your surgical facelift as an option, but now we're looking more into the lasers, radiofrequency microneedling treatments, which are offering minimal downtime and no anesthesia required for any of these treatments. Which brings us to the whole reason we're here is the Sandro Lift procedure. Sandro Lift addresses many of the age-related changes that we see in the face. It also addresses a lot of the common concerns that we're getting arising due to the Zoom boom. So Sandro Lift is a non-surgical, no downtime, multi-step ND-YAG procedure intended for the reduction of mild to moderate age-related facial skin laxity, skin rejuvenation, and under-eye circle reduction. We utilize the 1064 ND-YAG wavelength on the Sandro Dual device. This is a no downtime procedure utilizing the collagen and elastin regenerative properties of the laser. So you're going to have rejuvenated and renewed collagen, which will add support for the fat pads of the face while leaving the natural contour and shape of the face intact. So I'm actually going to cover a couple of patients I have treated with this to show you some of these deformities and how we can correct some of them. So as I mentioned earlier, some of the changes you have in the fat pads, you've developed the V-shape or tear trough deformity. This is one of the signs of aging. You lose volume and strength in the deep medial and lateral subocularis oculary fat pads. Those are the deep ones directly under the eye and just lateral of the eye. Reduction of these fat pads leads to sagging of the medial cheek fat pads. which is going to pull all that skin down. When combined with loss of volume of the inferior orbital fat pad, you have development of these under eye bags. So you see, this is where we would call our V-shaped deformity. It's a very common change we see and complaint that we see in aesthetics. We attribute these changes sometimes to being tired, not getting enough sleep, but there's actually many factors that contribute to this and exacerbate this. And there actually is an underlying physiological explanation for these changes. Aside from these structural changes, we also need to take into account hydration status, sleep status, overall health status when we're looking at this portion as well. So this patient here, she's a 75-year-old female. Our before and after shows her after one treatment session, 4 weeks apart. If you look after the treatment, patient had an excellent decrease in her under eye bags related to rejuvenation. We were able to plump up that skin, add more support via collagen, and kind of restore and lift up some of these sagging fat pads, restoring some volume of the cheek, volume under the eye, and reducing that under eye bag area. Next, we cover some of the volume shift of the medial cheek fat pad and nasolabial folds. This is a patient here, so it shows a great example of some of the just generic age-related changes. She's a 63-year-old female. She had loss of support of the deep fat pads, leading to sagging of the superficial ones. So with her, you can see some of the caudal shift in volume of the fat pad due to the loss of support of those deep fat pads. And then once again, that's dragging down the whole skin, leading to some of the under eye changes, along with some of the decrease in volume of the under eye fat pads. She also had the caudal shift, leading to development of the nasolabial folds, some of the jowls, and some development of perioral lines as well. You see the jowls and perioral lines do become very prominent with this sagging skin and the sagging fat pads. So this patient I treated with 2 treatments separated by 4 weeks, and this after photo was taken 1 week after the second treatment. So after the treatment, you can see a significant improvement in the depth of the nasolabial folds, restoration of the volume of the fat pads under the eyes and in the middle of the face and the cheek area. All this lifting and volume changes led to a reduction in her jowls. And the treatment also just leads to an overall younger appearance, healthier appearing skin. Last patient I'm going to discuss is a 33-year-old female. She complained of protrusion of the infraorbital fat pad with some deep, dark under eye circles. She's a 30-year-old patient. She actually did admit to a history of Adderall abuse as well as chronic dehydration. Before treatment, you could see the under eye bags with a sunken appearance as well as the very dark under eye circles. She felt that these really made her look older than they were. She was focused on that as her main complaint. So the under eye circles is likely multifactorial because she is young. She's not having complete degradation or weakening of those fat pads, but she does have some thin skin. Like I said, we do have the dilation of the capillaries of the vessels under the eyes. And these little capillaries can rupture, causing some of the darkness under the eye. So she was treated with the first treatment, and 24 hours later, she sends me a picture, ecstatic, because you can see a significant change in her under eye bags, the dark circles, and her loose skin. Unfortunately, she actually missed her second appointment because she had some family illnesses and she had COVID herself, but she did come back to me 3 months later. So 3 months after one treatment, you could see that structurally the patient had maintained her results. She still had that tight under eye area, the reduction of bags, significant change from her first picture, as well as the under eye circles. That kind of stayed reduced as well. So when we're talking about any type of procedure, we want to be careful with our patient selection, looking at precautions. Particularly with this treatment, it's great because you can use it on just about any Fitzpatrick. I've tested on 1 through 5. You can use it on 6 because you're using the 1064. So you're focusing more on water than melanin. So you're able to use it on basically across the Fitzpatrick spectrum. Your indication for treatment, as you said before, you want to treat the middle, lower, and under eye areas. You can actually use it for the neck as well. I have treated the forehead, but the anatomy is much different, especially with the aging process compared to the rest of the face. The bones are not as deep as some of the other areas. So the areas do heat up much quicker, and they tend to become more uncomfortable with this treatment. You do want to review the history and see if there are any photosensitizing medication or topical vitamin A products prior to treatment. You do want them to try to avoid direct sun exposure for 1 to 2 weeks prior to the procedure. They have a history of HSV. You do want to give them prophylactic. As always, eye protection for the provider, the patient, as well as anybody within the room. I do try to avoid eyebrows or any area containing hair, especially with male treating in the facial region. The 1064, like we said, beginning of slides, it can treat and be used for hair removal. So you don't want to, have a male coming in and remove a beard that they want, or start treating the eyebrows and move some eyebrows. This is a very comfortable procedure, but you can have some discomfort. So I do offer everyone topical anesthetic. One thing I do like about this device, which we'll go into as I'm doing the treatment, is the device offers continuous temperature monitoring on the handpiece. And this is great because you can avoid any adverse effects due to elevation of temperature and burning in the skin. So at this point, I'm actually going to get myself and my model ready for a demonstration. I'm going to pass it back to Caitlin to introduce Chris Stock.
Thank you for that, Dr. Ellis. While Dr. Mike is preparing the demo, I'd like to introduce Chris Stock, the Director of MD Power for MD360. I'd also like to remind and welcome you to type any questions into the comment box, and we'll address as many of them as possible at the end of the presentation.
Good evening. My name's Chris Stock. I'm the Operations Director for MD Power. So I'm just going to give you a sort of a brief overview of the MD Power program and how it sort of ties in to what we've been talking about this evening and the devices from MD360. So when you purchase a device, we often wrap in some services, and this is what the MD Power program is. Now, I want to start with a quote that I've been sharing for many years. The relationship that you have with the customer is the one thing your competitor cannot copy. And what I mean by this is, with any treatment, the practice down the road can, buy the equipment, they can, offer that. What really differentiate practices these days is the relationship with the patient. We talk about the patient experience. This is where you can get real competitive advantage in the marketplace. So the philosophy from MD Power, myself, and everyone is really focused around how do we help you guys develop even better relationships with your patients? How do we sort of help you in that journey? So, purchasing a device is one thing. How do we then support that so you can get the best, in terms of offering those treatments to your patients? These are some of the conversations that I've had, probably in the last 6 months as well, in terms of the challenge, that exists. I was at a show before pre-COVID actually, so and speaking to a doctor, I spent $600,000 on devices, and they are collecting dust. And it sort of it's a true statement, and I think we've all heard it. And it's a crazy situation. We shouldn't be, we shouldn't be putting practices, doctors, physicians, businesses into this sort of environment. Another one, more recently, I bought a device for 500,000, and I've done 7 treatments in 5 months. These are Wontech, non-MD360 clients, I hasten to add, and that's not something that we're prepared for and prepared to accept within the MD Power program. We recognize that assistance is needed, and we're there to help and to solve this problem with you and with your practice. So let's talk about predictable patient acquisition. Really, there's sort of 5 steps in terms of getting a patient in the front door. It starts with the marketing, it starts with social media, it starts with the website, it starts with non-digital. There's a huge focus, quite rightly, around digital marketing, but actually it's some of the non-digital, that you can do, building key relationships with the local gym, the hair salon, building those local relationships with the chamber, speaking at sort of chamber events. It's word of mouth. So I'm totally into and totally support digital marketing. It's absolutely critical, but let's not forget the non-digital. And so we've got to think about, how do we get people in the front door through the marketing? Second step is, when that phone rings, when that web inquiry comes in, how do we schedule them? How do we sort of manage that from, that initial inquiry into getting into a consultation? when we also look at the process, we recognize that the physicians, the providers are happiest now when it moves into sort of the consultation stage, but ultimately the procedure stage. One of the plastic surgeons that I'm working with, or we're working with right now, he just says, I just want to be in the OR. I just want to be treating patients. So the consultation is something I'm prepared to do, but really I'm happiest in that sort of procedure area. And we recognize in MD Power that we need to provide a program that allows you to do what you want to do the most, and that's be consulting and procedures, operations, etc. And then the final piece in that, in terms of that predictable patient acquisition, is the reputation piece. Now, you can also argue that needs to be at the front, but starting from scratch, reputation is based on the treatments you give, the Google reviews, the 5 stars, the Yelp, everything you can do. And again, this is part of that word of mouth. It's that referrals and the retention of getting the patients back in. On the back of that, then it's email marketing, which then starts the whole process again. So we can not just have new patients, but we can have existing patients coming back. And so that's the sort of the 5 steps that we see, and you play that role in that middle ground in terms of that consultation and the procedure. That's where you're the happiest, and that's where we want to sort of keep you. So the MD Power program is really about sort of focusing on the areas that we can sort of add value to you, in terms of the website, the social media, creating those things, SEO, in terms of scheduling patients. So when the lead comes in, do you do it, or can we do that for you? Can we really sort of move that needle for you such that we get more patients in the front door and well qualified appointments, people that are ready to spend and ready to buy? Allows you to do your bit, and then we can help on the back end as well. So the MD Power program is really about helping you take that responsibility, create, manage that sort of end-to-end process. It doesn't mean we're going to do everything, but we're going to certainly do the elements that are going to make the biggest difference with you and support you through that program. And the program, when we talk MD Power, is 12 months. We don't see this as sort of a quick wash and a wax and send you on your way. We see this as a long-term engagement to really sort of help the practice implement new treatments and the technology, and really get the business benefit out of it and do what you love, treat patients. Now, this is a very big slide. I'm not going to go through all of it, but these are the 6 pillars of success of the MD Power program. And when we engage, then we sort of start thinking, okay, what are the pieces that we need of this jigsaw? What are the things that you need? If you have a website, we don't need to bring the website. We can put more effort elsewhere. If you don't have a good enough website, we'll build one for you. We'll come on site. We've got the clinical training. So Wontech do a great job, in terms of the purchase, in terms of that clinical training. But what about selling the treatments? How do you sort of manage that patient arriving at the front desk and going through? Again, some of you may have slick processes in place. Others, we need to sort of hone those sales processes, the consult process from start to finish. So we'll pick and choose and pull the elements of the 6 pillars together to really deliver a tailored program for 12 months that's going to deliver the results, which is pay for the machine, number 1, and secondly, make profits and grow the revenue. And when I talk, yes, we focus on the device that you've bought, but actually, when we talk sales training, that applies to the whole practice. When we talk about the website, we build the website for the whole practice. So again, there's multiple benefits. So some of it is about focusing on the device, some of it is about focusing on the practice, and sort of driving that change, driving that increase, so you see the real value from the device, from the practice growing, and from the MD Power program. So let's go into a little bit more detail. So in terms of the marketing side, I'm going to just simplify that. So this is around sort of the practice growth and patient engagement. I said we can create a website, but specifically, we bring to the party sort of social media posts around the new purchase, patient e-blasts, blogs. We create a video docu-series for you. So we come in and film you as a provider, maybe in your sort of relaxed environment, showing then how you're using the treatment and some testimonials. So we create as much sort of specific content for you as we launch. I've mentioned we build the website, so we're doing an audit, we design, we provide 12 months of SEO, 3 to 6 months of PPC to really get you going. I think most people recognize SEO takes 3-6 months, so let's cover that gap with pay-per-click from Google. We can set up Google My Business, we can set up Yelp, we can create email addresses that are to your practice, and then we can add some extras around that in terms of regular e-blasts, social media and blogs, etc. But I'm sort of giving you the sort of a starting point in terms of the program. Then I want to talk about the phone rings. So I'm focused, at this stage then around how do we turn those leads into closed leads, into patients. So there's 3 parts to this. There's some consulting. So we're going to do some discovery, investigation, analyze what's happening, what's working, what's not within the practice. So we sort of do a deep dive. We'll do some mystery shopping at this stage to see how things are working. And we start to sort of build a plan that's tailored to your practice. We're not a cookie cutter approach. This is sort of world-class consulting. We understand what's happening and what do we need to do, and then we'll work with you over the 12 months to sort of drive those changes. We bring in the sales training piece. Now, we might not like the word sales, it brings up all sorts of connotations, but the consult process is a sales conversation. And everyone from the front desk to the patient care coordinator, the nurse, the provider, the surgeon, they're all involved in that sales conversation, and we have that down so it's incredibly slick. So that's typically 1 to 2 days on site with the team, walking through that whole process, pulling out the little changes, the chinks, to make it more effective, because at the end of the day, we want to drive a higher level of conversion, we want higher patient satisfaction, and that's how we're going to drive it. And some of the modules that we focus is around the art of questioning, handling the objection, storytelling, and mastering the mindset. So the training goes on throughout the year, and we delve into the elements of the training as and when we need it. And then supporting that is the coaching side. So one of the first things we'll introduce is a sales meeting, and that drives that sort of mentality. We'll look at what the goals are for the practice, and then how do we systematically grow those goals in a way that's appropriate. And I say that because some practices don't want to be measured on revenue. It feels, it doesn't feel right as a practice that we're measuring revenue. And I'm working with one I'm thinking right now, and so we just think about procedures. They want to drive X number of procedures per month, and so it takes away the revenue number, but behind the scenes there's obviously revenue associated with it. But whatever those measures are that are applicable to your practice, we start driving those numbers through that sales meeting. We're an accountability partner. We're there to support, we're there to provide that continued development and that behavioral change. It's about shifting mindsets in terms of where we are and where we want to go to. I don't want to go into too much detail, but I just want to sort of show what the first 4 weeks can look like in terms of the program. And this would be a typical plan, but it would be very much tailored to you based on conversations. As I say, you've got the lead gen and the lead conversion. So it starts with the practice familiarization, business reviews, setting the goals, finalizing expectations. And then on the marketing side, we're looking at the website, if there is one, what needs to change, what needs to happen, do we have Google, Yelp, etc. And then from the sales side, we're looking at the processes, how it works, what what works, what doesn't work, and we can start implementing some basic skills. And we continue to sort of work through, and this is sort of one of 4 or 5, and again, if you're interested, we can sort of share that at a later point, but sort of what does the 90-day plan look like? And then, you know, I'm happy to build one in terms of what it would look like for you based on some quick conversations in terms of supporting what you're looking to do and where you want to go to. And then finally, one of the other things that we can do, and we talked about this in one of the previous slides, is we can assist in taking those leads. So we want more and more leads, but we want qualified leads. And really what we want is consultations. So we have a contact center, and we can engage with your patients in that initial inquiry. We have a team of highly qualified patient care coordinators that can take that initial lead, handle that lead, and put it straight into your EMR as a qualified consult. And so it frees up some of that space for your guys. Now, I think here, patient care coordinators, you might have 1, you might have 5 in your practice, but if we start sending you more and more leads, they need to be focused in the moment with the people in front of them, the patients they're seeing. They need to be living and breathing in the practice, picking up the phone, following up, chasing patients post-consult is not something that they tend to like doing. And so we can outsource that to a team of qualified patient care coordinators as part of this. And again, there's a lot here, and we pick and choose, as I say, how we bring it all together and how we deliver not just the device, but the support and the services to really maximize your investment in that device. So that was a whistle-stop tour of the MD Power program by Sales MD. I hope that's been useful. Again, if there's questions, please put them in to the chat and I can answer them at the end. I'm now going to hand back to, I believe, Dr. Mike, who's now going to be doing a live demonstration.
All right, so I'm going to be going through each of the steps of the Sandro Lift procedure for you guys. We'll go through step by step. I'll explain a bit of what I'm doing with each step. Like I said, if there's any questions, we'll be happy to answer them towards the end. But we're going to start with our first step. Our first step is our dermal heating step. It's used as a gentle heating step with low energy to prepare the superficial layers of skin for the deeper treatments. Our deeper treatments are going to require more energy, so heating the skin allows us to easily penetrate the superficial layers. So anytime I'm treating, it's always about 1 centimeter off the skin for this step. I'm in a painting motion, nice and smooth. For this step, I'm aiming to do about 500 to 1,000 pulses per side, usually 1 to 2 pulses. This is a very gentle step, so people usually say like, it feels like a hot stone massage. It's not painful, not uncomfortable. But if people are sensitive or have very thin skin, where you're getting down to the bone easy, they could get uncomfortable pretty quickly. So it's just a matter of watching their comfort. So another thing with this, like I mentioned earlier, is the temperature monitoring on the device. If you see on the device, there's a little green light right there. That tells me I'm in a safe treatment zone. I'm under 42 degrees Celsius. If it were blue, it would tell me I was under 32 degrees Celsius, and anything over 42 degrees Celsius is going to turn red. So I have my real-time monitoring that's telling me where I'm at, so I know that I'm safe with my treatment. The 1064 wavelength is great because it's safe on all skin types. It's one of the longest wavelengths we utilize in aesthetics. It's been shown effective in many different treatments for treating wrinkles, rejuvenating collagen, and helping to build new collagen. So on the device, I usually like to pass back and forth between the two, painting motion, about 1 centimeter off the skin. So one thing we mentioned before is the sagging of the superficial fat pads, which causes, a lot of the wrinkles, a lot of the changes we see. Rejuvenating the collagen is going to add that new support, lift everything up. A great thing about this procedure, like we said, you're going to start seeing some immediate results, but there's no downtime. Your skin is going to be a little bit red afterward just from the heat exchange, but that irritation goes away in 15, 20 minutes. So This could be a lunchtime procedure, it could be a morning procedure before an evening event, which, you know, like, yeah, no downtime is what people are looking for. All right. We cut over to our next treatment step. This is our dermal remodeling step. This is one of the treatment steps I do ask people to use some of the anesthetic, because this does use the cooling spray, which can get a little bit uncomfortable. We're using the same spot size. Pulse duration is different, and the fluency, we have a little more energy. So for this one, I'm actually coming in contact with the skin and then pulsing each area independently, making sure I don't have more than 20% overlap. Once again, you know, watching my temperature gauge, making sure I'm not heating the skin too much. You can see the different colors as the skin is heating up. And my red just tells me I was a little bit too close to my previous one, so I just need to add some more space. So first step, like I said, we're kind of preheating the skin, getting it ready for these next steps. This is allowing the energy in this step to be delivered deeper. This helps a lot with the skin texture and the skin tone. So I usually do about 20 to 40 pulses on each side, depending on patient tolerance. Once again, monitoring for skin temperature, and usually 2 to 4 passes per side. And as you get more comfortable, you can go much faster, but for demonstration purposes, I just wanted to go nice and slow so everyone could see what we're doing here. Actually, Kim isn't flinching. It's very comfortable. She's numbed up, so she's not feeling much of anything. So we're going to get set up for our third step. Other thing that's great about the procedure, it's a very quick procedure. It can be done in 30, 40 minutes. So we're going into our Genesis part 1. We're utilizing our 7mm spot size and short pulse duration. We're doing conservative fluence. Smaller spot size delivers the energy more superficially. Treatment is performed with a painting-like motion because we're at 8 Hertz, so we're delivering a lot of energy per second. Our goal is usually 2,000 to 3,000 pulses per side and 2 to 3 passes based on the patient tolerance. You know, you do want to watch for your end results, which is going to be significant erythema, or if your temperature sensor is, you know, showing that you're over 42 degrees Celsius for an extended period of time. And always, you know, any intolerance for the patient is going to be a reason to stop as well. So in this type of treatment, they have 2 proteins they've discovered have been basically affected by this type of treatment. You have your TGF beta protein, which is your major regulator of your extracellular matrix proteins in your skin. It stimulates your fibroblast proliferation and your collagen production. This laser frequency will actually stimulate your TGF beta. At the same time, it will actually inhibit one of the other proteins, your MMP1, your matrix melanoproteinase 1. So the studies have shown effluents between 7 to 9 have had a significant effect on collagen formation. So for this treatment, we're at effluents of 8 right in the middle. I like to start right in the middle because based on patient tolerance, we could either increase or decrease so we could get the full number of pulses on each side. Just for you know, time purposes, I am cutting the pulse a little bit stronger, but I did 700 pulses on that first side and it went very quickly. So you can see how quickly you get through the 2,000 to 3,000 pulses. Once again, my temperature is staying in a good area. My light is green. Patient is comfortable. Some erythema, but that's expected with the amount of heat and energy that we're delivering. Alrighty. Our next step is our Genesis step 2. Very similar to the previous step. We do change the spot size to a larger spot size. This allows for less scatter of the laser as it enters the skin and more focused delivery of energy. So once again, you know, low fluence allows us to deliver a lot of energy, but safely because we're not going to overheat that tissue. And once again, as we discussed, the low fluency causes an effect on that, on the TGF-beta and your MMP proteins. So your MMP protein actually causes degradation of your collagen. They've done photocarcinogenic studies, and they've shown that in your basal cell and your squamous cell cancers, you do have an increased activity of this MMP1 breakdown of collagen, breakdown of fibrogen. So inhibiting this protein by using this laser frequency, you're basically helping their skin because you're getting rid of this protein that's causing risks for some of the cancers, but it's also decreasing the amount that it could break down. So two things we're doing: TGF-beta, we're increasing the collagen, increasing the fibrogen, new collagen, new support system. Decreasing the MMP1, we're going to decrease the amount of collagen that can be broken down. So that's going to give us good, long-lasting results, continued results even as the patient continues to heal. And you're going to get results usually for 6 to 9 months, depending on how fast the patient breaks down the proteins. So Genesis 1 and 2, like I said, they work together to deliver the energy to the skin to work on these proteins. Once again, very comfortable treatment, suggesting 1 to 3,000 pulses per side in 1 to 3 passes. But once again, for time purposes, I'm just going to cut this a little bit short so I can get to our last step. The last step, I do tell everyone this is an optional step. This is for people who have concerns with the under eye circles, but it also does help tighten up the skin. So I go with a smaller spot size. I am at a low repeat rate. I do 1 hertz because I don't want to be treating too fast. I am going close to the eye, so I do use a tongue depressor to make sure I don't enter the orbital rim. So this is a great treatment for dark under eye circles. You do have those very superficial capillaries that can burst, which cause those deep under eye circles. So for treatment, I find my orbital rim, line my probe right up to it, and just individual pulses around that orbital rim. If you have some bigger, deeper under eye circles, you could always pull the skin down, but always protecting the eye, protecting the orbit. So what this treatment is doing, just like our other vessel treatments that you do on the legs or your visualization treatments in the face, we're basically obliterating these capillaries that are there. There's millions of them, so it's not causing any type of negative skin effects, but you're getting rid of the superficial ones that are causing the darkness under the circles. This is another one. It is uncomfortable, so numbing anesthetic is important for this one, but I like to do 2 to 3 passes depending on patient tolerance. It's quick and easy. The gas does pulse, so that allows us to deliver the energy deeply. And that's simple. Sometimes you do get a little bit of hair in the way, and it causes that little bit of puff of smoke, but it comes right off. That's actually part of the reason why I do use the depressor also, to keep anything, give me something to lean on, so I'm not getting any of the eyelash or anything that might be hanging out of the eyelid. So our treatment schedule, we suggest 3 to 4 treatments at 1 month intervals. Collagen usually takes up to a full 12 weeks to be fully rebuilt after the treatment. This can be expected to last 6 to 9 months after the last treatment. And then I do recommend that you have come in for regular follow-ups to prolong your treatments every 3 to 6 months, based on tell the patient when you start to see things start to change again, come back in, let's get another follow-up treatment going. Aftercare, you do want to avoid any direct sun exposure. Apply sunscreen right afterwards. Sometimes, but very rarely, you might have crust develop. You don't want to pick these lesions. They would fall off in a max of 3 to 5 days. If there's anything, I do put Aquaphor on them just to kind of have some of the soothing effect before they leave and to kind of close up the skin. So you may resume their regular skin regimen, skincare routine within 24 hours after treatment. I do just tell them do not exfoliate if you have any of the crust for 2 to 3 days or until those little crusts fall off. So one thing that is interesting to talk about is your treatment pairing. This is a great standalone treatment, but you can pair it up for even better results. PRP injections is one that I started doing with some patients. You inject PRP directly into the cheeks after the laser, similar to the way you would inject a filler into the cheek. Basically, you're getting more of the healing factors, more of the regenerative factors, so you're getting better protein and collagen synthesis with that. There's a couple of studies out that have shown that you could actually inject hyaluronic acid and then do laser treatment in the same day. They're citing some better, more natural looking results. Once again, these studies have had very small sample sizes, so I would just err on the side of caution if you're doing this. If there is a significant pigment or skin color changes, you could flip over to your 755 laser or use an IPL for your pigment reduction. People have the concern of your superficial skin treatments, hydrofacial or skin wave treatment to help clean and restore the skin surface. One note of caution I would make is that you want to do the hydrofacial after the laser treatment. The laser, the 764 wavelength, does target water molecules, so we don't want to pump that skin full of water and then use the laser. So laser first and then a hydrofacial treatment. And then if you're concerned about superficial skin texture, you could always use your CO2 laser resurfacing. So I think we're going to jump into some questions now.
Yeah, I have a couple for you here, Dr. Mike. One of the questions is, does this last longer than Botox and filler?
It does. It definitely lasts longer than Botox. Botox, you're getting your 3 to 4 months at best. Filler is very dependent on how fast the patient breaks down the filler, the type of filler that you use, and where you inject it. You are going to be able to get your tear troughs, but you're going to be able to get a more natural look than when you're using filler. There are, like I said, there are studies out there where you can combine the two, but I like this because you have no downtime, a more natural look, and less risk of side effects or adverse effects when compared to using filler.
Great. Another one here is there any bruising or downtime associated with the treatment?
None whatsoever. So if you see on Kim's face, there's just a little bit of redness from the laser, but this redness lasts 20 minutes, a half hour. Like running your hands in the hot water, they turn red. 20 minutes, 30 minutes later, they're back to normal. So I tell her, by the time she drives home, those marks will be gone. So it could be a lunchtime procedure. It could be done in the morning if you have an event in the evening. Because you do see that change, but the redness will be gone very quickly.
Great. Another one here is, can you treat pigment or vessels the same day?
You can. I would do the laser treat, the Sandro Lift first, just because I don't want to add too much extra heat into the skin before I do this treatment. So I would do the entire Sandro Lift procedure, flip over to my 755, and treat whichever lesions I was concerned about or the patient was concerned about.
And does this require any skin prep, hydroquinone, or anything of that sort?
None whatsoever. I do offer just a topical anesthetic, just for comfort reasons. I've undergone the procedure without any, so it is tolerable. But I always want people to be comfortable. So the only thing I offer is the topical anesthetic. You do want to make sure they are off any vitamin A products for at least 2 weeks beforehand, because it's one of the photosensitizing medications.
Great. And it looks like we just have a couple more. What are you charging for the procedure, or how much could you charge for the procedure?
So for this procedure, I sell it in packages of 3. I sell it for $1,000. And if people want to come in for individual treatments, I charge $499 for the treatment.
Great. And then last one here is this treatment safe on all skin types?
Yep, you're using the 1064 wavelength, so you're not focusing on any melanin. You're focusing more on the water molecules and the collagen molecules. So you could do it on all skin types. I've had people from super pale skin type 1. I've had skin type 5s in here. I've done it. Everybody's been safe, no side effects at all. With my skin types 5s and 6, I do turn the fluids down just a tiny bit for the first treatment, just for safety reasons, because their skin is going to heat up, or may heat up a little bit faster. So just as a caution, I do start lower and build up.
All right. Oh, we have one more coming in here. Will the YAG actually remove pigment during the treatment?
You might get some pigment removal, but it's not going to be anything significant, especially if you have darker sunspots or birthmarks in the area. Like I said, you might get a little bit of superficial, but not much.
All right, great. It looks like that cuts it for our questions. So thank you, Dr. Mike, for your time and for your expertise. Chris, thank you for your informative presentation on the MD Power program. And thank you to all of our guests for joining us.